Welcome to Successful Parenting, where we, Jackie Rue and Robin Choquette, share practical skills for families to build resilience and healthy connections. As practicing professionals and parents ourselves, we hope this podcast is a resource for parents to grow, reflect, and learn more about themselves and their children. Our approach is simple, tangible, and most importantly, we lead with compassion for the integrity of the families we serve. This podcast should not be taken as medical advice and is intended for informational purposes only. We love our work, and we can't wait to watch families gain confidence and open themselves up to new ways of successful parenting.
Hello, Robin.
Hey there. What's been happening?
Getting back into the swing of things. I think fall is my favorite time of year. And, while we're not quite at fall, schools are back in session in Chicagoland. And it's been fun seeing all the children get off the bus and, everybody running towards the school. And so it's definitely a fun time of year.
I think it holds both sides, right? As much as a lot of kids are excited, and I know my grandkids in particular are just asking them, and they're excited to be back in school, and there's so many things they're excited for, but then there's those other things. So I think it holds both sides of the coin for most families. They're excited to get the rhythm, getting that structure back in place, but then it also holds a lot more stress in some ways and expectations for the kids. And then, right, Jackie, we start to see in our practices that increase of calls, the increase of inquiries, the increase of, hey, things are going on for us and we need to talk.
We have probably a 60% increase in phone calls from families really wanting to look for resources for themselves, for their children. We notice stress levels start to rise. Some would think, okay, we had the summer, the sunshine, so now we're feeling strong and healthy. But so often the transition into fall can be very stressful. Parents will call and say, how do I even know what is healthy, what is not, when to intervene, when to supervise? And so I know we've covered some of this in past topics, but today really focusing on when to respond to a concern, when to seek out help, when to gather other resources to support your child or yourself. Because I think so often we think we have to do it alone, or maybe this child's behavior is just typical, but maybe it's not. So just diving into that conversation today, I know many families have asked for this topic to be covered.
Yes. And as we're going into that, I want to say something to our listeners. If you can relate to this, be careful of judging yourself. Jackie and I work with a family, and that's one thing that a parent has said, I feel really guilty. There were signs and I didn't address it. And this was a child that always, was doing academically strong. And the parent now feels guilty that they've said, I've kind of let some of this go. And now I really need to address it. And I feel like it's even stronger if you have in the past noticed, but you haven't responded, or let's say years out from this, you're like, oh, wait a minute, I should have responded. I remember listening to Jackie and Robin, and we really encourage you not to feel that guilt. Right, Jackie? Don't feel guilt over this.
Well, definitely. And two, I've talked to several parents recently, and I think we put a lot of pressure on ourselves that when we're struggling, there's some shame. There's so much shame still and stigma around that. We're starting to see mental health similar to medical, right? So we treat our mental health much like we would if we had a physical or a medical issue. And so there really shouldn't be shame around getting help for yourself. And I think a long time ago, it was, something was wrong with you, or it was viewed as you couldn't handle things. And I think there's definitely been a shift in that perspective.
Right. Absolutely. I would agree. I think it's just like your physical health. You still go to the doctor yearly. You still do things that check in for your physical health, even when in a healthy state. What are you doing for your mental health? Does it equal what you do for your physical health? And I think that's an interesting perspective and a way to think about it.
Definitely. And I think, one family reached out recently and said, I'm not sure if this is a concern or if it's typical behavior. How do I know?
And I think that's a question I often hear as well. When do we know? So what are some of the questions? Because I start asking questions to parents at that point. Jackie, what do you do at that point when you're working with someone?
One thing I look for is, has there been a big shift in behavior? Has there been kind of a change? Maybe there's been more stress in the family. Maybe there's been a big transition or an adjustment. Also, if there is a big shift in behavior, and I often ask families, does the child's behavior, does it interrupt their functioning? Are they having issues maybe at school, at home, or with friends? Is it happening in more than one area? If it's just at school, maybe look at kind of what's going on at the school. If they haven't had issues before in school and all of a sudden they are, or maybe all of a sudden they're not wanting to go, starting to take a look at what's going on in the school year, what's going on for the child in that current situation.
Yeah, I like those. So the two you've said is that increase in, well, there's actually three, an increase in stress at home or somewhere. So it's kind of this transition. And then is there a shift or change in a behavior or in behaviors? And then looking at functioning across the board at school, at home, with friends, kind of those. I think another question in terms of what you're saying, I'm going to piggyback on is in particular, is there a shift and change in school performance? And in school performance, I think about not only is this grades, it's activities they once were involved in, friends. Is there been a shift in how your child engages and participates in school? I think that's an indicator as well, right?
For sure. And I think I love what you always say, Robin, is not every child is going to be brilliant in school. Not every child is going to just soar and excel in school. It's not everybody's necessarily thing.
Mm-hmm.
I love how you always say every child has different strengths and weaknesses, and it's important that we set realistic expectations for that child. We see a lot of children that are stressed out and they view their expectation for themselves as they should be perfect or always, excel. And when we start to shift those expectations, that can help. If you see a child that is struggling, they're not wanting to participate maybe in activities they once were, I think those can be signs as well.
You're right. Absolutely. If you see your child seeming, when talk about academics, that they're really trying and they're putting in some effort, but the grades don't seem to match their effort that they put in, to me, that's another indicator of, wait a minute, what's going on here? What do we have if we see a child that's trying, but it just doesn't seem to be aligned? Then I always say, well, let's think about that. And maybe we need to dive in and do a little more research into that. Maybe we need to kind of expand and figure out what's going on.
Yes. And, the other one I see a lot is the stomach aches, the headaches. This time of year, I'm sure many listeners out here can relate. Their children start to have stomach aches and headaches and they don't feel well. Often, you don't need to necessarily bring the child into counseling right away. If you have some concerns, as parents, I often advise reach out and talk to someone and kind of talk through what's going on. Sometimes changing some things at home, sometimes shifting some parenting strategies can really make a difference in the child's behavior. And it doesn't mean that the parents are doing anything wrong. I had a mom tell me recently when her child's anxious, she finds that she does a lot of talking and reassurance. She changed some of her responses to the child, and it really changed how he managed his anxiety.
Mm-hmm. And what we see with the increase in physical complaints, we see, refusal to go to school or going late, or we start to see a disengagement in some way because of the physical complaints, the headaches, the stomach aches, those type of things. I think one of the things with that is I often ask about patterns. What do we see? Keep a log. Do we need to jump in right now and see someone, or keep a log of what's happening? Journal of, my child seems on Sunday night that they're not feeling so great, or Monday morning could be an indicator that your child is feeling more anxious or something else at that period in time. And that can be really helpful.
Definitely. And the one thing I hear sometimes is, all children are on their electronics all the time.
Mm-hmm.
All children love video games. This is just how they communicate with friends. Look at how it's impacting your child. We know that, as we've talked about on previous episodes, children with ADHD and anxiety and other mental health issues are more prone to addiction with electronics and video games in particular. Not every child can handle the same thing. And so if you notice that your child is on electronics more and more, less motivated for school, less motivated for social interactions, joining things outside of the home, that might be a time to just look at, maybe this isn't the healthiest balance. How do we incorporate more balance? So often with children, I think it really is about just balance and making sure that even though someone else is doing the same thing, it doesn't necessarily mean it's the healthiest for your child. And again, we know that children, when you're changing expectations in the home or you're changing responses, they can become very upset or emotionally charged.
Mm-hmm.
And I think it's important that we recognize it takes 2 weeks to change any behavior. So as your parenting is shifting, just know that it's pretty normal that kids are going to have big reactions.
Right. Absolutely. So some of the things I've been taking notes as we're talking, Jackie, some of the indicators we would say, is there a change in the family, something that's changed that increases stress? There's a shift in behaviors. There's a change in functioning. There's a change in performance at school, trying, but although you see the effort, but then the outcome doesn't seem to match. Increase in physical complaints, if their schedule changes in terms of that they're refusing or disengaging in things that they used to. If we kind of bullet pointed that for our listeners, is that kind of stuff?
Yes.
Yeah.
The only other thing I would say is if you feel like at different stages, I found this to be true as a parent. If you feel like I just can't communicate with my child, I feel like we're always fighting. I say one thing and they just completely erupt. And sometimes it can be about finding different ways to communicate. The reality is all families struggle, us recognizing that it's really about learning how to manage some of this stuff.
Absolutely. Where would you say, Jackie, if a family wants to start talking, where's the first place you would encourage a family to start that process and asking questions, do you think?
And I recognize each community is different and is going to have different resources. And so in general, if you have a pediatrician, you have a good relationship, with your pediatrician.
Yeah.
Talking to the pediatrician, if not, or in conjunction with the school district. I think most schools have a school counselor or a school social worker.
I agree. I like all of those. I think that's a positive way. And since that relationship's already built, often the pediatrician, I think, is easier to have that conversation with.
Yes. And I know we had Dr. Lauren McArdle on an earlier episode, and she talked about even if you have a younger child, early intervention can be found through the school district, that they'll provide it. And so reaching out, even if you have a child that is not in school yet, maybe the child's 2 or 3, you can still reach out to the school district where you live and possibly get services as well.
Right. They do provide those and do those assessments and get that proper kind of services engaged with the family. I think one of the things, if a family has insurance or a family doesn't have insurance, that's always a question, like what's covered, what's not. I always encourage families, if they do, simply call their insurance company and have that conversation. A lot of families don't recognize where those behavioral health services can come from. And when someone asks, I said, it's kind of in a pot. And if you're meeting a deductible, let's say for your physical, it's the same pot as your behavioral mental health services. And so then you can utilize those as well and have a copay, have a co-insurance. A lot of times an insurance company, they'll give you a list of providers and you can call and talk to them directly. I always encourage people to call and ask those questions and get to know the providers. Jackie and I, we both love those not-for-profits. I mean, they often provide resources or can also help mental health agencies in your community. There's another great place to start to search and just start to find out, to start asking those questions. And it may take a little bit in some communities to find those. If you ask your county health department, may have those services or can direct you to any of those agencies that can provide it as well. What do you think about that, Jackie? What have you found out about navigating?
It can be a challenge sometimes because
right.
I think sometimes there's wait lists and things like that. And so if you find yourself in that situation, rest assured that it does take time. And I know many families are frustrated, but I think, again, pediatrician, talking to the school, as we've talked about, reaching out to your insurance. Oftentimes there's community mental health or mental health boards in the community that you can call, or your child's school will help. And so even if financial barriers are present, there's often other ways to seek counseling, seek support. And so I think that's something to think about. And again, sometimes even starting with virtual, even though it might not be ideal, can be a way to go in the beginning. I know there's some services that offer different options for virtual that can be a little bit less expensive. And sometimes just starting there in the time being, if you feel like you really need to get started, can be an option.
Right. And then slide into the schedule where you can do in person if those aren't available. I like all of those as well.
Well, and I also say if maybe, let's say you're concerned you might need to get into a psychiatrist, but you're not sure and you're on the fence, but there's like a 4 to 6 month waiting list. I always say make the appointment, have it just in case, and then you can always cancel it or change it. Neuropsychological testing is a comprehensive assessment that some families will choose to do for their children to really kind of get some diagnoses down, as well as assess for things like ADHD, anxiety, any learning disabilities, executive functioning. There can be long wait lists for that too, depending on where you live. And so again, you might not be sure that you want to do that or explore that, but I would still, if you're on the fence, make that appointment so you have it.
Right. And if you can get into that therapist, you could start that and then have that down the road as well. So yes. I do like that. Yes.
And schools will do assessments, but it can be a little bit different what they provide in the school than what you get when you do it privately. And so sometimes, depending on what you're looking for, depending on what you're trying to rule out or rule in, sometimes families do it privately as well. Mm-hmm. In terms of level of care, oftentimes when families are concerned about a child, parents might have a session with a therapist to discuss what they're seeing and just really talk about what the therapist feels like the child's needs are based on kind of what they're presenting. Or it may just be the parents are really working on different strategies at home to support the child. Oftentimes when the child, there's concerns and you reach out to the school, there might be things that the school can do, such as a 504 or other interventions as extensive as an IEP that can support the child, that can really make a difference. And we've had several episodes where we've talked about that. So if you're interested in those topics, listeners, feel free to listen back.
Right.
But in terms of other levels of care, oftentimes we see that a child might start with individual therapy, typically once a week. It doesn't have to go on forever, really starting with that once a week. Hopefully the therapist is communicating with the pediatrician, the school. Sometimes the child might need to be seen in a group as well. Maybe they're meeting individually and in a group. Maybe there's family sessions involved. If after a period of time, the child is still really struggling, not functioning, having a really difficult time, there are what's called programs that can help. The most minimal level would be an intensive outpatient program that typically meets 3 days a week for 3 to 4 hours at a time. And really those programs are typically skill-based. If the child is not functioning, maybe it's to a place that there's concerns about safeties as well. Then there's a partial level, which is 5 days a week, 6 hours a day. And that's more, with a psychiatrist involved typically and medical evaluation and really working on, supporting that child at a different level. And all the way, if there's any safety concerns, if a child or a teen can't keep themselves safe, they would do a safety assessment. And at that point, the child may be hospitalized for like a week, that they would be actually staying in a hospital. I know that's a really scary step for families, but I have had families take that step and they have been very thankful they did, because it really, really helped the child.
Yeah, there's so many different levels, and I think it's hard and it can be very confusing for families. If you ever have any questions, certainly you can reach out to us and we can help you to answer those questions. Or once you get involved with a therapist, they should be able to answer those questions. And most of these programs that Jackie spoke about, they're really great about explaining kind of each of those levels and what would that mean and what that looks like. And once again, those are covered typically by insurance, and those can be accessed fairly easily. Sometimes there are waiting lists, unfortunately, but for the most part, you can find an opening somewhere in your community. Well, I think this is kind of ending our conversation. Anything you want to add, Jackie?
No, I love how you started, talking about, as parents, we're all doing the best we can and not to be hard on ourselves. And, can't emphasize enough, all children struggle at different points. Just because your child is struggling right now does not mean that they're not going to be successful. It just means that they're struggling. And I think so oftentimes as parents, we worry and we're hard on ourselves and we feel guilty and we feel like we're not doing enough. But it's really about building that resiliency and making sure that we're taking care of ourselves and our children. The healthier we are, the healthier our children will be. And so it's a process. But I think, the fact that you're even listening to this episode, listeners, says that you're really, just doing all you can to learn about parenting and learn about what works best.
Yes. Absolutely. Well, let's wrap it up. Thank you, listeners, for joining us today. Hope you have a great day. And Jackie, I will see you later.
See you later. Have a great day.
Okay. Bye.
Bye.
Thank you for joining us, and make sure to subscribe and like us to catch our next episode, where we will take you on a journey to find new ways of successful parenting.